It's nice to see everyone this morning at Effie's seminar. It's great that you all came back. So I am really excited to introduce Dr. Eri Uguchi today. I actually have had sort of a side interest in the topic that she's going to talk about, the Great East Japan earthquake and everything that happened after that, including the nuclear accident, for both personal and professional reasons. So personally, and here I don't usually do complicated outfit things, but I have a reveal. So I don't know if you knew this about me, but I too am a nuclear accident survivor. I was living very close to 3 Mile Island. We could see the steam coming off the cooling towers from my bedroom when the nuclear accident happened in 1979. So I'm one of the few Americans that was evacuated due to a nuclear accident. And after that, there were, similar to Japan, a lot of studies that happened. I'm also interested professionally in this topic because it's a really interesting natural experiment question. So I was really excited when actually Kumi told me that she had visited Fukushima University and learned about all of this stuff and that Eri was here and she could talk about it because I didn't realize that we had this incredible connection. So I'm just going to do a really brief introduction, in part because I don't speak Japanese, so there wasn't that much I could grab from me or see me. But what I do know, and you know, sometimes I just make stuff up, but what I do know is that you studied epidemiology at Osaka University and UCLA, and that you are an associate professor at Fukushima Medical University, and also you've been a visiting associate professor for the last year here at the University of Minnesota Division of Epidemiology. So Dr. Uguchi came here about a year ago with her 2 children, and sadly, in about a week and a half, she's going back to Japan. So if anyone wants to chat with her or has questions, now's the perfect opportunity. And while she's been here, she's been working with some of our CVD cohort data, doing some research, and I know you're going to say a little bit more about that. So I just want to say thank you so much for, I'm sure things are super busy for you with packing up and getting ready to head back. We really appreciate you being able to take some time and talk to us about your research. So thank you.
Thank you very much for introduction. My name is Eri Uguchi. I'm gonna talk about the Great East Japan earthquake and subsequent survey in Fukushima, Japan. I'm gonna leave in 10 days, but I want to introduce myself. I don't know how much you know about Japan, but I am from Kobe. Kobe is here. And I went to Osaka University for undergrad and master, and then went to UCLA for Master of Public Health. And I came back to Osaka to get my PhD in medicine. This is Professor Iso, and I moved to Ehime. Ehime is in Shikoku for assistant professor, and this is Professor Tanigawa. And then after that, I moved to Okayama. Is here for assistant professor, and then I moved to Fukushima. Fukushima is here, and Kobe to Fukushima is around 8 hours by car. It's like here to Jeru's Tower. That's the farthest place I went by car. So this is Professor Ohira, and these 3 professors, professor is Professor Komachi. He unfortunately passed away 4 years ago at the age of 93, and his good friend is and yeah, at when we had the big celebration party of his 77th birthday party. I remember that Professor Bragban sent him a very nice video of great music. It was very, yeah, it was very, yeah, fun. And thanks to everybody here, like Pam, Jim, Sanat, Anna, Kumi, David, Pam, Henry, Ellen, Ivan, Pierre, Rachel, and all over I couldn't find a picture, but all of the staff and graduate student, I could spend very good year here, and I researched very good topic, and I enjoyed stay here a lot. Thank you very much. So I want to talk about the earthquake. The Great East Japan earthquake occurred in Japan on March 11, 2011. So it's 23 years ago. And with the nuclear accident subsequently occurring at the Fukushima Daiichi nuclear power plant. So, as Rachel told us, Kumi-san and her husband went to three main places in Fukushima. Yeah, other prefecture has other museums, but Fukushima is very different because the Fukushima Prefecture has now still have the nuclear power plant. This is a Ukedo Elementary School. At the time the earthquake happened, there were students there, but all of the students could escape. That's the good thing about this elementary school. That's why it could become the museum. There is another elementary school whose student, almost all student, died. Sorry for my English, died. But yeah, this elementary school is very good. Teachers managed students very well, students and parents very well. And this one is the Nuclear Disaster Memorial Museum. This says nuclear power plant is very bright and future energy, but unfortunately, it affected the people's life. This is all the displays. The people on the fire engine was alive, which was very good. And then this one is the earthquake happened, I was in Osaka. So I didn't know at all about the accident. Like, I think you didn't know either, but yeah, thank you. And this place is Tokyo Electric Power Company Holdings, TEPCO, the Commission Archive Center. This place is very funny, very interesting. When you go there, we need to sit in front of the big screen, and then the movie starts. The movie starts with apologizing. We are very sorry to make this big accident happen. Yeah, and I haven't experienced the accident, and I felt like weird, weird. I felt weird, but this is the explosion. hydrogen explosion of the nuclear power plant. And after the explosion, the nuclear power plant became like this. Now I went to around here. We can go nearby. The radiation level is not high, but in the building, the level is extremely high, and you can't go in. But nearby, it's safer. When in this place, they show how the accident happened, like time by time, and how they are decommissioning the nuclear power plant. So they are working. I thought it's very hard to work for nothing. So they are not making anything. They are just cleaning up of the accident. Yeah. So this is a movie. I don't know if you know about it, but this movie shows how these 50 people who stayed after the accident worked to make the disaster smaller. Yeah, it was good, but but it was good. Yeah, so the bad things about Fukushima was that earthquake happened, and then after 15 minutes later, tsunami happened. So the nuclear power plant worked very good when the earthquake happened. But after 50 minutes later, the tsunami happened. So because of the tsunami, the emergency electricity was down. That's why the nuclear meltdown happened and the accident happened. So because of that, the people nearby had to evacuate from the place. Number of direct deaths is bigger in Miyagi or Iwate. So 9,000 and 4,000. But in Fukushima was only 1,600. This is direct death from earthquake or tsunami. But bad thing about Fukushima is that there is a indirect disaster related death because of this accident. They died not because of the radiation, because of the evacuation. Yeah, because of the evacuation, their health status gets bad very easily and rapidly. Evacuation affects you a lot. Yeah. At the time the radiation, the explosion happened, the government or people didn't know where the radiation is. So the government said in the 20 inside of this circle need to evacuate. So they evacuate nearby. Then, but the radiation is affected by wind a lot. And they found out later that it goes this way. So this Namie village is this shape. So they moved like this way, like this way. And so they moved and had to move it again. That affects God too. They changed the accident was bigger than the thought. So they changed it to the evacuation area to 30 kilometer. Yeah, but actually it was bigger than that. At the time that the accident happened, 12% of the prefecture was the evacuation area. But now it's reduced to 2.4% of the area. This area, this pink area, is still the place people cannot live. So at the accident, when the accident happened, I was not there. And Fukushima Health Management Survey started after the accident. And then after I went to Fukushima, we studied, I and the researcher in epidemiology department studied analysis of national database of Fukushima. I'm gonna introduce these studies. This Fukushima Health Management Survey was launched for the purpose of estimating external radiation dose and assessing the health status of Fukushima residents. It consists of a basic survey and detailed surveys. And basic survey examine the radiation dose, and monitoring detailed survey examines detailed surveys are thyroid ultrasound examination survey, comprehensive health check, mental health and lifestyle survey, and pregnancy and birth survey. I want to introduce about this comprehensive health check. To assess and address the health status of this health check was conducted to assess and address the health status of residents in evacuation areas with the aim to prevent lifestyle-related disease and detect and treat diseases in their early stages. We know retrospective analysis of pre and post disaster data on health checkups on residents of the 13 municipalities were conducted. So this in this study, only this area participants are from these areas, and this gray area, most of the people evacuated, and these areas they stayed at their own place. Participants are residents living in 13 municipalities, including evacuation areas. So what we did was just comparing before and after the earthquake. We used the data of 2010 and 2011, but if the data was not there, we used 2009 or 2008, 2012. The nearest data from the earthquake were used for analysis if the participants received the checkups more than 2 times and average follow-up duration was 1.6 years. This is the result of the body weight and BMI. So comparison, the change of the body weight was 1.2, like they increased 1.2 kilogram after the earthquake, and BMI for 0.6. And the change was bigger in evacuation areas than the non-evacuation area. So their hypertension increased. Dyslipidemia increased. This is before and this is after. This is the percentage. And diabetes increased. This liver dysfunction increased. And atrial fibrillation increased. And this is the result of the compared to non-evacuees, people who evacuated increased more, like 1.8 more than the non-evacuees. This is the blue is men and red is women. So for overweight, 1.8 higher than the non-evacuees, 1.5. So hypertension 1.2. Hypo HDL is 1.4, diabetes 1.4, metabolic syndrome like around 2 men, and hyperuricemia is 1.4 for men. So from those results, we know that there were increase after the disaster in body weight, hypertension, dyslipidemia, diabetes, liver dysfunction, atrial fibrillation, and those increase were higher in evacuation area. However, we didn't know what happened afterwards. So long-term progress was unknown, and those results were only from 13 municipalities area. So no large-scale reports comparing evacuated area with non-evacuated area of Fukushima. About 30,000 people are still displaced now. It is expected that the health hazards caused by the earthquake are still continuing. So we did longer examination. The purpose was to examine trends in the proportion of people with metabolic syndrome in the 10 years before and after the earthquake. So participants are a lot bigger than before. We use national database of received information and specified health examination. Fukushima Prefecture residents who participated in specific health checkups. All of the people in Japan need to go to the health checkup annually. So they usually go, not all of them, but so in fiscal year 2008 to 2017 is 40 to 74, because this health checkup is only for this age years old. So the numbers are 300,000 to 400,000 per year. The cumulative total was like 3 million. The prevalence of metabolic syndrome over time were calculated by region. Post-disaster prevalence ratio compared to pre-disaster, so before the disaster, using Poisson regression analysis. We did a lot more analysis, but I want to introduce this result from this analysis. So Fukushima is here, and the Fukushima Daiichi nuclear power plant, the explosion happened here. And those who live this red area evacuated to other areas. Fukushima is usually divided into three areas: mountainous area, central area, and coastal area. The Fukushima Medical University is around here. And Fukushima Station is around here, and Fukushima Station and Koriyama Station, the only station which the goods train stops. This is a little bit more city side area in Fukushima. Yeah, like this. The numbers of participants were biggest in central area because this is the city area. And mountain area is the farthest place from the accident. And coastal area is the area, maybe the evacuee escape too. The participation rate of the checkup was like this. So when the accident happened, the disaster happened, especially in the evacuation area, the participation rate was lower, but yeah, like around 40%. So the results is like this. This is the national average of the percent prevalence of metabolic syndrome. It didn't change in a lot in 10 years. And this is mountainous area. It increased a little bit. And this is central area, increased a little bit in coastal area. But for the evacuation area, it increased like this. So a lot more increase than other areas. So all of them, because of the numbers, whatever you do, I get the significance. But before, compared to this previous years, after the disaster, the metabolic syndrome was a lot high. This is men and this is women. Usually men have metabolic syndrome a lot higher than women. This is we use the Japanese metabolic syndrome definition, but we did the world international definition too. But the number would change, but the result didn't change. This is younger and older. For the disaster, all the people is affected a lot more than the younger people. Younger people can be adopted very soon, like they move to other area and they enjoy their life. But older people who evacuated from other area, they get um their health status very bad very soon. So compared to the pre-disaster period, the post-disaster metabolic syndrome prevalence in Fukushima Prefecture is particularly high in evacuated areas, and that this condition has persisted for a long period of time. So why the metabolic syndrome was higher in evacuation area? We checked other factors like overweight was the same result. Hypertension for the people who live in evacuation area can get the compensation money from the government, so they can go to hospital. They get medication. So controlled hypertension, the percentage of controlled hypertension increased, but it's still hypertension. But we don't know why hypertension decreased afterwards. This lipidemia didn't improve. Diabetes increased and decreased. And this is stroke. This is received data, and so it's very difficult to get the real stroke. But cardiovascular disease increased a little bit later than the accident because their lifestyle changed, and then the lifestyle disease increased, and then cardiovascular disease increased. So the stroke increased like 4 years later. And what kind of lifestyle change we examined? Because of the radiation, the kid couldn't go out. Mothers said to kids that, no, don't go out because of the radiation. So the year of the disaster, the physical examination percentage of those who do physical activity decreased a lot, but it recovered very soon. The government tried to make the very safe inside activity place anywhere in Fukushima. That's good for people who has kids. Yeah, it recovered, but the people who can't sleep didn't recover like this. This is the percentage of those who had psychological distress. The national average of people who have psychological distress is around 3%. But in Fukushima, it's still very high. That's another reason. And that's why they can't sleep. Yeah, from the results of the study of these areas, what kind of program in mental health they have? The people from evacuation area is not happy and have a lot of stress, and they don't have interest to anything and cannot sleep, like I said before, and no confidence and don't have interest to others and no hope, tired, no appetite. Yeah, like those problems. And so the people who laugh a lot, how, how often do you laugh? Like, do you laugh once a day or more? At least once a day, that's good. If you don't meet people, you don't laugh, right? Yeah. So people who laugh is lower, and it if you laugh more, you are healthier. Like this, if you you laugh every day, your health status is very good. So if you don't laugh, the health status is very bad. So in Fukushima, we do the laughter yoga once a year to make people laugh. Very small percentage of the people in Fukushima. So I want to make some summary of the results. As a background of increased prevalence of metabolic syndrome in evacuated areas, which have not decreased over time, increased prevalence of obesity, hypertension, dyslipidemia, and diabetes were observed. And although physical activity has recovered, the prevalence of those with lower sleep quality and those with psychological distress were found to be higher over time. Furthermore, the incidence of stroke has also increased several years after the disaster. Continued lifestyle-related disease countermeasures are needed. So, as a conclusion, continuous prevention programs against lifestyle-related diseases should be implemented to prevent future lifestyle-related diseases, including CVDs, in post-disaster evacuees. It is hoped that these results can be used for health measures for evacuees in future large-scale disasters. Thank you very much.
Thank you so much, Ari. That was really fantastic. Super interesting research. I want to present you with a seminar thank you present.
Wow.
Happy seminar class.
Very nice.
We really appreciate you taking the time to present to us. So thank you so much. I want to open it up for questions for the next few minutes. Does anyone have any questions?
Yep.
How did you make people laugh?
So the question was, how did you make people laugh?
That's a very good question. So I don't know if you know that, but if you as the age gets older, they don't laugh. They don't have the source of laugh. So there's a thing called laughter yoga. So it's the imitation now laugh. There's a license of laughter yoga leader, and the leaders we invite leaders of laughter yoga, and they lead laughter. You want to? No. but they have a lot of poses, like hundreds, or I heard that there are a lot of people in United States too, like more than 100 country, they say of the laughter yoga. So that all the people can laugh without the factor of laugh.
Very interesting data, thank you. I wonder, did you say anything, a couple questions, did you say anything about cancer rates in this group? And second, are there any comparisons with Chernobyl, another nuclear disaster in recent years, or the data from the Atomic Bomb Casualty Commission in Hiroshima?
Thank you very much. About the cancer, I think the cancer increase in the future too, because of the lifestyle changes. They evacuate, those who evacuated increase the percentage of smoke, and the nutrition changes. There are a lot of hormone factors, those to CVD and cancer. So it's for preventing cancer, it's very important to something for the future disaster. And about the Chernobyl, the disaster, disaster was a lot bigger in Chernobyl. In Fukushima, I think because the government hid it a little bit in the beginning, but they opened it to the information earlier than the Chernobyl, and the effect was a lot smaller for them. But I think I don't know if for the older people they may live longer if they just stayed in the evacuation area, even though they get radiation because they died because of the change of the lifestyle. I mean, we don't know about that.
Can you show us your sleep results again?